Mr. Johnson. So what I believe is going on is that you've irritated a structure in your low back. So our spine is made up of bones stacked on top of each other with a cushion-like structure in between called a disc. We also have our spinal cord as well as the nerves that come off of our spinal cord at each level. These nerves run down from our low back all the way down our leg. So what can happen is that this disc can begin to press on this nerve, especially when we have to bend forward a lot to pick up heavy objects, or when we just have to bend forward a lot without heavy objects. To counter this, if we bend backwards, this disc is actually going to move forward away from this nerve to give it some relief. When you begin to bend forward a lot and you move that disc backwards onto this nerve, you're going to start to feel some pain that's going down your leg, similar to the pain that you're experiencing. So do you have any questions for me so far? So what we did today is we did something similar to when you're bending backwards that makes your pain better. And I pressed on the middle of your back. We saw that this actually helped your pain because the pain in your leg was no longer there. It started moving up back into your low back. And that's a great response to physical therapy. That's what we are hoping happens. So you're going to be a great candidate for physical therapy. With this, I would like to see you come to physical therapy for 6 to 8 weeks, coming once or twice a week with what works best for your work schedule. I understand that you do have some concerns, one of them being your age. So with this, it's not uncommon amongst your age group to start seeing this happen. It's especially common among workers who do heavy lifting, who are lifting heavy objects frequently, and also among people who usually have to sit for long periods of time, such as working at a desk or, in your case, driving for 6 hours. But as we saw today, we were able to decrease the pain in your leg, which is what we're going to work towards, is decreasing the pain in your leg. We're going to hopefully get it to go into your low back only. And then from there, we're going to get it to diminish, hopefully completely. With physical therapy, what we can do is we're going to work on your lifting mechanics. We're going to work on strengthening exercises. We're going to work on sitting positions. As I know, being able to sit for 6 hours is one of your goals. We're going to be able to work on positions so that while you're at a rest break or when you're at a rest stop, you'll be able to do some quick exercises with the equipment you have to be able to decrease your pain and hopefully prevent it from happening while you're on the road and you're able to drive those 6 hours. So our main goals are going to be able to get you working back to what you were doing before. We're going to hopefully be able to create a toolkit for you to use so that if you do experience this pain again, you'll be able to get it under control and get it to go away. And we're going to add some additional things for you to be able to do at the gym as well as at home and on the road. So with that, I do have 2 exercises. One of them you're actually doing already, and it is the small leaning back exercise. So I want this exercise to be pain-free. I want it to be a very small lean back where you place your hands on your low back and you do a small movement backwards. Again, I don't want this one to be painful. You may start to feel some discomfort or some tightness. With this one, we do want to see the pain in your leg start moving up to just being in your low back. I want you to do this one 10 times and then rest. And then I want you to repeat that exercise again. I want you to do this exercise every day or any time that you start to feel your pain going down in your leg and you're able to do the rest stop break and stuff like that. This would be a good one to do. The next exercise is right before bedtime. I want you to lay up on your elbows for 30 seconds. Again, this one's going to be similar precautions to this one. I don't want this one to be painful. I want this one to be comfortable. You may start to feel that discomfort or that tightness, but what we're looking for here is no pain in the leg and just kind of moving up towards the back. I want you to do this one again for 30 seconds. I want you to rest, and then I want you to repeat this one. But this one I want done maybe every other day with 1 day rest in between. Do you have any questions over your exercises? Okay, so before next or in between visits, what I'd like you to keep track of is kind of how you're feeling, where your pain is, where it's not. Also, I really want to hear about how your exercises are going. So please keep in mind how you're feeling while you're doing your exercises and how that changes between now and next visit. Do you have any remaining questions for me? Okay, so if you do come up with any questions between now and your next visit, do not hesitate to call. Do not hesitate to shoot me an email. My card with that information is up at the front desk. I'm going to go ahead and walk you to our scheduler so she can get you scheduled for your next visit. And don't hesitate to reach out. And it was great meeting you today and great working with you. Have a great day.